Welcome to a research proposal for Does AI Improve Child Welfare Outcomes? AI is an automated cognitive thought process using programming which is designed to create exchanges between humans and computers by using machine learning and deep learning models, according to Boss, Janish, and Kabudi. Social workers, according to Yin, are ready to adopt AI in their work. AI has been used in the medical field for antibiotic resistance effectively by Ravkin and others, and it's been shown in radiotherapy to be effective by Cui and others. It's been used as a digital psychotherapist in the treatment of depression effectively by Alonzi and others, and transcripts between human and computers could not be differentiated between human and humans by psychologists. AI has been used effectively in depression, anxiety, and substance use treatment through treatment augmentation by Key, anxiety and depression, and substance use assessment by Afshar and others. It's been used in suicide assessment effectively. It's been used in Spanish-speaking cultures for treatment of disorders and in Aboriginal culture with mothers for risk assessment. There's only, though, 1 or 2 early studies showing machine learning and risk screening in child welfare, according to Hornby, Zeller, and Associates, which is very old. So therefore, there still remains a large gap in the research with very little AI being tested in child welfare. The problem then is there's no or little research demonstrating the effectiveness in AI on child welfare documentation. Therefore, we have to ask the questions, will an AI documentation model have a statistically significant improvement of successful closures for family preservation services over a control group? Family Preservation Services, FPS, is treatment for an entire household who have had substantiated abuse, child abuse, or neglect within the home, with the goal of keeping the family together. Will an AI documentation model have a statistically significant improvement on increasing the protective factors or protective factor survey revised scores with family preservation services upon case closures? Protective factors are those things that keep the family together. Therefore, our hypotheses are the alternative, the use of an AI documentation model shows a statistically significant improvement of successful FPS case closures as compared to a control group, or the null, it will not. The use of an AI documentation model shows a statistically significant improvement of protective factor survey overall scores between 90 days to case closure surveys, or it will not. The variables are the IV, this documentation model, the DV being 2, case closure status unsuccessful or successful per DCS, whether the children are still in the home or not, and the PFS2 mean total score. The methods here are the participants will be families in FPS in Indiana, families that are recommended for CBT. There will be FPS staff that have 1 year of experience in child welfare, and sample size according to a G-Power analysis being 100 families, with the critical Z being 1.64 and the critical T being 1.94. Procedures would be obtaining Liberty IRB and DCS approval, families consent, a control group which would have documentation model with no AI and then an AI model with AI turned on, the PFS2 measured 90 days and at case closure. The materials would be twofold, DCS data on success cases, and the PFS2 revised by Sprague, Jones, and others. The measures are the IV with a logistic regression and the PFS2 measured with a t-test at 90 days and upon case closure. This aligns with Liberty through James chapter 1:27, religion being pure and undefiled, working with orphans and widows. The Grace Playbook says that Liberty extends grace to students. In this case, the students would then extend grace to the FPS staff, who would bring that grace right into the home of these family preservation families. The mission mentions change is possible and can freely happen. Let's add on that even in the most stigmatized populations of the world, that change can happen. This proposal aligns with the grant NOT HD 25008. This proposal answers how does AI impact children and families' health and well-being. This proposal fills the tech gap that this grant mentions. In conclusion, testing AI will improve outcomes in child welfare, and it's a necessity to increase those positive outcomes in family preservation. It can assist social workers in making a generational impact by removing trauma, reducing the cost to children and family from removal. It's shown in research literature to have a statistically significant effect in assessing, assisting, and in treatment. This proposal supports the research community by growing the extent of methods useful to keep children and families together. Thank you.